Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to do something a little different. We're not just learning about a medical condition, we're actually going to solve a mystery. We've got a patient, a surgery that was supposedly a success, but a very, very strange walk. So let's put on our detective hats and dive right into the case.
So meet our patient. He's 62, just got a brand new hip, and everyone says the operation went off without a hitch. But look at how he's walking. Something is clearly off. He's got this really noticeable lurch. So the big question, the mystery we have to solve is, why? What is his body trying to tell us?
Okay, so every good mystery needs a case file, right? Let's officially open the file on our 62-year-old patient and just lay out all the facts as we know them.
Here's the rundown, the basic facts. Our patient is 62. He was dealing with some really severe osteoarthritis. You know, that's the common wear and tear kind of arthritis that just grinds down the cartilage in your joints. To fix it, he had a right total hip replacement, which is also called an arthroplasty. Now, the surgery itself, it was a success. But here's the twist. He's now got this new problem, a very specific kind of difficulty walking that he did not have before.
Now this is where the real detective work begins. Because it turns out, hidden inside that unusual walk are two critical telltale signs. These two clues are the key to cracking this whole case. So let's get into it and analyze the evidence.
And here we go. This is our evidence, side by side. On the left, he can see that when he tries to stand on his operated right leg, his left hip just drops down. Then on the right, when he's actually walking, his whole upper body leans way over to the right. Now, these are not just random movements, okay? They're very specific patterns.
Okay, so our first clue actually has a name. It's called the Trendelenburg Sign. This is what we're seeing when he stands on one leg. The contralateral, which is just a fancy word for opposite, side of his pelvis drops. So to put it simply, he stands on his right leg and his left hip sags down. This is a classic textbook sign that something is failing to give him support.
And clue number 2 is this, the gluteus medius lurch. Now, listen, this is really important. This isn't just a limp, it is a compensatory move. His body is leaning to the ipsilateral, or the same weak side, so he leans to his right. Why? It's actually a pretty clever subconscious strategy his body is using to shift his center of gravity and, keep him from falling over.
So, let's recap. We've got a hip drop, and we've got a body lurch. Now, these two signs together, they don't really point to a problem with the new hip joint itself. Nope, they point to a very specific set of muscles that just aren't firing the way they're supposed to. And if the muscles aren't working, well, then you have to look at what controls them. It's time to unmask the real culprit here, a failing nerve.
So, the muscles that are supposed to be holding your pelvis nice and level, those are your hip abductors. We're talking specifically about the gluteus medius and the gluteus minimus. Their primary job in life is to contract and prevent that Trendelenburg hip drop we just saw. Our patient's signs are screaming that these muscles are failing to do their job.
And look, it's just a simple chain of command. If the gluteus medius and minimus muscles aren't getting the message to work, we can trace that wire right back to the source, the culprit. The one thing controlling these muscles is the superior gluteal nerve. An injury to this nerve is what's causing this whole cascade of problems.
Okay, so we've identified our culprit. Case closed, right? Well, not quite. We need to know how the crime happened. And to understand that, we have to go to the scene and we have to dig into the beautiful and simple physics of how we all stay balanced and how something like surgery can throw a wrench in the works.
Let's just break this down. It's actually super simple. Anytime you stand on one leg, gravity is right there, trying to pull your unsupported side down. It's just physics. To fight back, your hip abductor muscles on the leg you're standing on have to fire like crazy to act as a counterbalance and keep your pelvis level. But if those muscles are weak, maybe because their nerve supply has been damaged, they just can't win that fight against gravity. Gravity wins, and the hip drops. Simple as that. And that right there is the final piece of our puzzle. Because where does the superior gluteal nerve live? It runs right through the exact area where a surgeon is working during a hip replacement. This makes it incredibly vulnerable to being stretched, or maybe compressed, or even just slightly damaged during the procedure. The timing, the symptoms, it all points to the surgery is the scene of the crime.
Now, any good detective knows you have to rule out the other suspects to be absolutely sure. I mean, there are other big nerves around the hip, so how do we know for sure that it's the superior gluteal nerve and not one of its neighbors? Well, let's go check their alibis.
So here's our nerve lineup. Let's run through it.
If it were the inferior gluteal nerve, he'd have trouble standing up from a chair. That's not his problem. A femoral nerve issue? His knee would be buckling. We don't see that. The obturator nerve? That affects the inner thigh. Again, not what's happening. And the big one, the sciatic nerve. That would cause much more widespread problems like foot drop. See? None of these other suspects match our patient's very unique combination of a contralateral hip drop and an ipsilateral lurch. The evidence is absolutely conclusive. It has to be the superior gluteal nerve.
So, the case is closed. We started with a mysterious limp, we followed the clues, and we identified the muscles, the nerve, and the cause of the injury. And this whole investigation, it all boils down to a single, really powerful diagnostic formula that you can take away from this. Here it is. A pelvic drop on the opposite side, plus a trunk lean to the same side, equals a superior gluteal nerve injury. That's it. It's this elegant little equation that turns a really confusing walk into a crystal clear diagnosis. If you can remember this formula, you'll be able to spot this condition every single time.
You know, what this case really shows is that our bodies are constantly talking to us. They're telling us stories through all these signs and compensations. The real challenge, and honestly the fun part, is just learning how to read that language. It really makes you wonder, doesn't it? What other stories are our bodies telling us if we only knew how to look? Thanks for helping us solve the mystery today.